Have you ever worried that your cat's upset stomach might be something serious? Hi, I'm Lyndall from Vetster, and today we're talking all about cat stomach issues. We'll cover common symptoms, why these digestive problems happen, when it's time to see the vet, and how you can help prevent or treat them. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Right, let's hand it over to the experts.
Caring for a cat with an upset stomach, whether it is vomiting or diarrhea, is something many pet owners go through. Sometimes these issues clear up on their own, but it's important to know when to call the vet. You might wonder what the most common signs of stomach trouble are, why cats get these digestive problems, and when they truly need professional care. You may also be curious about ways to help your cat feel better, and whether there's anything you can do to prevent these problems entirely. Cats can have an upset stomach for all kinds of reasons, some harmless, others more serious. So knowing when to see a vet is an essential part of being a responsible cat parent. Stomach upset refers to a variety of digestive issues in cats. You might notice symptoms like vomiting, diarrhea, lethargy, reduced appetite, weight loss, or excessive drooling. These signs often point to some type of GI irritation or a related condition. Figuring out the exact cause is not always straightforward, and sometimes your vet may need to run diagnostic tests. A common trigger is anything related to food. Just like people, cats can be allergic or sensitive to certain ingredients, and sudden changes in their diet or feeding spoiled food can lead to an upset stomach. You might see loose stools, vomiting, or a drop in appetite if food sensitivities are the culprit. Another frequent cause is dietary indiscretion, which means eating something that is not part of their regular diet. Because cats are curious, they might nibble on houseplants, sneak bites from another pet's dish, or grab table scraps. These episodes typically resolve on their own unless your cat has ingested a toxin or something indigestible, which can be an emergency. GI inflammation is another possibility. Conditions like inflammatory bowel disease, gastroenteritis, pancreatitis, colitis, or gastritis can all irritate the digestive system and often point to a deeper health issue that needs professional attention. Viruses or bacteria can also cause digestive troubles, especially in young kittens or unvaccinated cats. Staying current on vaccinations helps prevent some of the most contagious and serious infections, although not every feline disease can be prevented with vaccines. Parasites are another factor. While healthy cats might not show symptoms, they can sometimes experience weight loss, diarrhea, or vomiting, and some might even vomit adult worms. Then there are medical conditions like constipation, liver or kidney disease, endocrine disorders, injuries, ulcers, or even cancer. These can all present with digestive symptoms, ranging from mild to life-threatening. So regular checkups and testing are crucial. Most cases of vomiting or diarrhea in cats are caused by eating something that does not agree with them. They often clear up naturally if there is no toxin involved. You should still visit a vet if vomiting or diarrhea lasts longer than 24 hours. If your cat's belly looks bloated, if they are straining in the litter box, if there is digested blood or a large amount of fresh blood, or if your cat has a chronic health condition like diabetes or FIV. Certain situations always call for immediate vet attention, such as severe pain, difficulty in the litter box, or any of these symptoms in a young kitten. Even mild symptoms that do not improve after a day could indicate something more serious. If you see blood that looks like coffee grounds or large amounts of red blood in vomit or stool, that is a definite red flag. If you need extra guidance, an online vet can help you decide if it is time for an in-person visit. It is sometimes possible to treat a cat's upset stomach at home, but only under a veterinarian's guidance. Your vet might suggest a short fast, but fasting is not safe for every cat. Sudden dietary changes, even to a bland diet, can worsen symptoms, and many human medications are toxic to cats. If your cat is feeling that unwell, it is best to consult a vet for the safest treatment plan. You can reduce the chances of stomach trouble by keeping houseplants, human food, trash, medications, and other tempting items out of reach. Vaccinations and parasite prevention lower the risk of infectious disease and allow vets to spot issues early. Routine wellness checks and testing can catch potential problems before they become serious. And if you need to change your cat's food, do it gradually. Keeping their food and water clean and fresh also goes a long way. If you are concerned about your cat's sensitive stomach or want to support their digestion, a virtual vet can create a plan tailored to your cat's needs. Cats often do not show obvious signs of stomach pain, so if you notice a hunched posture, vocalizing, or your cat guarding its belly, it could be due to an injury or a bladder problem. Usually, stomach trouble shows up as vomiting or diarrhea rather than clear pain. If you see persistent vomiting or diarrhea, especially in a kitten or a cat with an existing medical condition, it is time to contact a professional. Avoid self-diagnosing or giving your cat any medication without expert advice. With the right care, prevention, and a little caution, you can help your furry friend stay healthy and comfortable. Thanks so much for joining us. If you found this video helpful, please hit that like button and subscribe to our channel for more pet health tips and guidance from Vetster.